Hi, my name is Bethany Gazinski, and I am here to talk a little bit about IDD, which is intellectual developmental disorders, along with GI issues, which I found some very fascinating information on. This article was brought to you by Chavid, Rushforth, Saj, and Michael in 2012. And I apologize for any of the pronunciations if those went wrong. I went ahead and left the link up there and made it blue so that you all can go to it later if you so choose to find out a little bit more about this issue. But let's go ahead and get started. So first, the most important thing to do right off the bat is talk a little bit about GI issues, which is kind of one of the main players here. And this can come in a variety of forms, which is things like, acid reflux, diarrhea, constipation, vomiting, heartburn. There are other symptoms, but those are kind of the most recognized forms a lot of the time. I also apologize. We're going to be talking about some kind of gross stuff, which is okay, but you've been warned. Now, a lot of research has been done on GI issues with individuals that have ASD, and that's kind of where a lot of the assumptions I think come from with how these two potential disorders interact. Now, IDD, which is similar in a similar vein, of course, but quite different a lot of the time, um, has also been linked with GI issues. It occurs very often in both of these populations. However, ASD has kind of gotten all the attention on that. It has been researched the heck out of, trust me, I know. But IDD is a little bit trickier to find. It's kind of neglected, even though it is still highly correlated. And some of the difficulty with discovering the extent of GI issues in this population is some communication barriers that can happen, right? So some individuals with IDD are completely nonverbal. That, of course, is a spectrum. So it can be really difficult for somebody with IDD to say exactly what is going on with themselves and be able to communicate that so that it can be fixed, right? Or they can get some medication for their stomach, or I mean, even a Tums, which would be an incredibly difficult position to be in. So yeah, a lot of the time these issues can remain undiscovered or have a crazily delayed diagnosis, and that's one of the main reasons why these researchers put this together. So the most common GI issues in individuals with IDD have classically been constipation, food sensitivity, so that's when your stomach acts up after eating certain foods, pain while using the bathroom, difficulty swallowing or vomiting, and diarrhea. Again, I did warn you earlier, so I apologize, but I did warn you. And this study attempted to determine the frequency of GI issues that occurred within a set of individuals with IDD. Now, I'm going to revisit this again in just a minute. But all of the participants in this study did have co-occurring GI and IDD diagnoses. However, it's the severity and the severity of the mental or the behavioral symptoms, I should say, that were really compared against each other. So in addition to this, the researchers recorded additional mental health issues that stemmed from the experienced GI problems. As you know, when I am hungry, of course, I tend to get a little bit mad at people for no reason, right? So we know that in neurotypical individuals, of course, the physical has an effect on the psychological. Why in the world would this be any different with somebody with IDD? Specifically with GI issues, it can really mess up a person's day, and that doesn't really matter who you are. That's just kind of a fact. So they really well, again, we'll get to this later, but they really buckled down on the before and after the GI issue was dealt with, and they had a plan for that, and how the behavior changed in between those 2 points. So what they actually did in this study was they took 10 people, which is not very many, but 10 adults who had been diagnosed with both GI problems and IDD and had a history of this going back a little ways. I've never seen a study that was quite set up like this, but what the researchers did was they actually, with consent, of course, of both the participants and the participants' families, they pulled some electronic mental health and medical records and compared that to a pre-existing list of signs and symptoms of GI problems. Um, and compared that with kind of their mental state over time in inpatient care facilities, and that's something that we'll look at a little bit. So, to say that a little bit of a clearer way, they did a history of the patient in this mental health setting, and then they said this person has been diagnosed with XYZ GI issue, and here's what happened after we treated that. Here's how their demeanor changed. Here's how their behavior changed. It was really interesting. I would very much encourage you to go back to that link and look at the individual cases, because some of the change over time is absolutely crazy. So 4 out of the 10 patients, what they actually found was that there were multiple GI issues experienced. Heartburn was the most common by quite a bit, followed by irritable bowel syndrome, and then constipation, then dyspepsia. Um, as the treatment, and of course not in all cases, there were some people who kind of stayed the same before and after, but as the treatment for GI issues progressed, specifically with constipation, I saw, um, so did the more challenging behaviors, as they call them. So things like, head banging, cutting, scratching, picking, aggressive tendencies towards others, and in a variety of forms. A lot of these actually subsided after constipation was treated, which again kind of makes sense. If you are in pain and you don't know what to do, you're gonna be agitated. There were a couple of patients who required less psychoactive medications, so they were, being treated for a schizoactive disorder, and after they were treated for GI, their medication went from 30 milligrams down to 10, 15, which is a crazy amount, right? Which kind of shows the impact that these GI issues have on this population. The conclusion that the researchers came to was that if we really paid attention to more of that true biopsychosocial view of the person, then we would probably improve patients' quality of life, make them overall happier, and also do good for the people around them to kind of stem that aggression a little bit and see what's actually going on, which really makes sense. So that was a really interesting article. Go ahead and let me know if you have any questions. You can always inbox me, and I will, yeah, we can talk a little bit more about it. But hope you all have a great one, and I hope you enjoyed my presentation. Thanks.